Hi, Linda Kopecki here, the interim director of the Minnesota Breastfeeding Coalition, and I'm just here to walk you through our 2022 budget. Here it is, and I'll just give you an explanation. And first of all, we'll start with this yellow section. The column A is right here. Column A is the item that's on our budget. Column B will be the amount. This yellow section is our general operating expenses. So these are the expenses that, with or without projects, with grants, or any contracts, this is what keeps Minnesota Breastfeeding Coalition going. One big line item is the executive director, which is myself. So this includes time spent providing leadership, but also managing several projects. So without the projects, this amount would be lower. This amount currently is for half-time, and that is for providing project management, but also providing leadership for the coalition. We have a contracted bookkeeper, technology like Zoom and our website and all of the technology we use these days, insurance, tax and accounting fees, and then we have a small line item for board and staff developments. Continue education for our board members and for staff, which is myself. I'm the only employee with the Minnesota Breastfeeding Coalition. This orange section are contractors. These are people that we have brought on to MBC in a short-term, temporary, part-time contracted positions for projects. So they are specific to projects. If we didn't have contracts and grants, we would not have these extra people working on specific projects. And then I'll scroll down to show you that this blue section, these are activities that are part of contracts or grants that Minnesota Breastfeeding Coalition has. If you look at this number right here, $183,000, that is our projected expenses for the year 2020. 63,000 of that is for general operations. So without contracts and grants or without projects, what do we need to keep going? And then the other bulk of that are the contractors and the activities. The rest of these columns, C through J, is where the money is coming from. And I'd like to just walk you through that quickly. This first one, C, 1807 span, that's money from the Centers for Disease Control and Prevention, and that is through Minnesota Department of Health, and that is for the 10-step learning collaborative. So improvement in policies and practices in hospitals around infant feeding. We're in the 4th year of 5 years of this project. ASTO, the Association for State and Territorial Health Officials. This is sort of an add-on to the 1807 span. So it's same funding, different activity, about 20,000 towards working with food pantries. We've been working with 3 food pantry systems around Minnesota to see how lactation subject matter experts and food insecurity subject matter experts can partner to serve families who are breastfeeding and who are food insecure. Column E is NACHO, that's the National Association for County and City Health Officials. This is a grant for continuity of care. So this is funding to actually backfill certain activities that we have going on, and just to make sure they're successful based on continuity of care, which is making sure that families that move through the systems from prenatal to postpartum and service provider and service never fall through the cracks, that there's a warm handoff, and that every part of their environment and their activities related to breastfeeding is fully supported and fully informed. This is the F.R. Bigelow Foundation, which is the F.W. Bigelow Foundation, sorry, which is local to East Metro. And that is to fund a project with Ramsey County WIC and Regents Hospital to support a handful of WIC peer counselors through the IBCLC preparation process. And all of these persons are Black, Indigenous, or persons of color. Column G, this is a contract with St. Paul Ramsey County Public Health, and it's to further their activities in the metro area as a breastfeeding friendly health department. And it's also supporting the Twin Cities Regional Breastfeeding Coalition. H, Department of Labor. This is a short-term grant that we have with the Minnesota Department of Labor and Industry to create a resource bank for workplace and childcare resources. This is the 90-day challenge that you'll hear about. And then this is an anonymous donation, and that is support the workforce development, so the diversity in the medical lactation workforce in Minnesota. And you'll see scrolling down here that the total money that we have available at the beginning of 2022 is just shy of, so that's our revenue, it's just shy of our projected expenses. So about $4,500 shy of our projected expenses. So we have a nearly balanced budget.